We've known about many diseases, many of the genes that cause this disease for decades, for more than a decade, and we haven't been able to change the course of the disease even in the people who we know the genetic mutations that cause the disease. That doesn't mean it doesn't give us a target. And so the problem with this disease is we don't know what the target is. We don't know what we're shooting at. And so when you're trying to cure a disease, you say, aha, here's the mechanism of the disease, this is what happens, and we're going to create some kind of treatment, whether it be a drug or an intervention or something that's going to interfere with that process, with that mechanism of disease. And the cancer biologists have been working on that for a long time, and they've been quite successful. And I think the most successful are the infectious disease people. I mean, before we knew that HIV existed, we had no idea how to treat that disease. Now HIV is a chronic disease. It's not a killer disease, per se. So until we really understand the underlying causes of this disease, we don't even know where we're going. And so that's why this is so important. If we can figure out some of the genetic factors that are important in this disease, that will point us toward mechanisms and pathways that may be important in terms of the development of the disease and even the progression of disease. And so if we can make this from a terminal disease into a chronic disease, meaning that instead of dying in 3 years, you die in 20 years, we've actually done something really well. And we can say to patients we've made a difference. But we're not going to be able to do that, I don't think, by just shooting blindly. We need targets, and these targets are going to come from genetics. I'm absolutely convinced. I'm not sure what genetic target it's going to be yet, but we have to look first.